Hey there, I'm Deanne Rosso, President and CEO of Elevate Wealth Advisory. I'm back again. So happy to be here with Paige Cummings, the Executive Director of the Athens Nurses Clinic, who is our next recipient of our 40 for 40 initiative, which, as you know, if you've been following our videos, Elevate Wealth turns 40 this year, and we're celebrating by honoring 40 organizations that do so much to give back to our community with a $1,000 donation in honor of our 40th birthday. And those organizations were chosen by our clients and team members, so they have a special place in all of our hearts. So welcome, Paige, and thank you so much for joining me today.
Well, thank you, and for having me. And this is such an honor, and we are so grateful to receive this money because taking care of sick people isn't cheap, as we all know from our health insurance comments.
Correct.
And that's what we were set up to do. It's hard to believe it now, but this is our going on our 34th year of operation.
Wow.
Back in the late 1980s, 85, 86, the community nurses from St. Mary's and Athens Regional Health Department used to go and have health fairs whenever there was a community event. And they realized that there were a lot of people that if something was abnormal, their blood sugar was too high, their blood pressure was too high, there was no place for them to go to get follow-up care. If you go to the emergency room, we have wonderful emergency rooms. I will never speak bad against an emergency room, but they weren't designed to be primary care providers. So the nurses all got together. They met with the mayor, they met with the commission, they met with the health department, and ended up getting a grant from the Georgia Nurses Association Foundation for the second free clinic in the state of Georgia. And it's on one of those real estate signs. I have it in my office, and it says the Georgia Nurses Association Foundation Athens Free Clinic for the Homeless. On Oconee Street Methodist, we used their basement. We were open one evening a week and to see street homeless. And within 2 months, our 1 day a week was full. And we were trying to make it longer and harder. And then people who were sheltered but homeless said, can we possibly come too? And those are our only two criteria, that you are uninsured and that you are indigent. So we started seeing the sheltered homeless, the people who were couch surfing, the people who were at the Salvation Army or at Bigger Vision, places like that. And then it got too busy. So the city helped us all look, and we found a new place to move to, and we moved to Reese Street. And the Masonic Lodge there helped us renovate half of the downstairs. We were open 4 days a week, and then we moved from just homeless to anyone who earned less than 150% of federal poverty level and didn't have insurance. Because it's amazing how many businesses, they just don't pay enough to get insurance. So we started that, and then we got, after 10 years, so big we couldn't even fit into that. I mean, it was wonderful of the Masons to do it, but one of our dental rooms was so small that the dentist could only work from the right side of the patient. So he'd have to lean over upside down and backwards like Ginger Rogers and her dancing in order to do anything on the left side. But about that time is when the Navy School was sold. So federal law says if federal property is not being used, it has to be offered to other federal other federal agencies. And if the other federal agencies don't want it, it has to be offered to the community for the use of the homeless. So everybody jumped in, Mayor Davis and the commissioners, and they created boards, and people came down from Washington. And there were about 16 nonprofit agencies dealing with homelessness who put in for a piece of that pie. You had to say which building and how you would renovate it. And it ended up with 6 won the actual grant. Then Dr. Adams at the university decided he needed it for a medical school, so he bought us out. And the money went to build what we now call the Resource Center, or ARCH, Athens Resource Center for the Homeless, at 240 North Avenue. The ground floor is the Homeless Day Service Center and some counseling for those patients. We're on the second floor. We have 8 exam rooms. We have 3 dental operatories. We see patients right now 3 days a week and sometimes a fourth day if we have a special clinic. But we got moved over here and it's like we just never slowed down. COVID did create its problems, and we were doing what we call parking lot medicine. We were telehealth for the basically healthy, and in the parking lot, full gown, masks, everything, looking in people's ears and looking down their throats to make sure they got what they need. Patients who come here, as I said, only have to be indigent and uninsured. And of course, since Georgia did not expand Medicaid, and since this new plan is going to probably bump more people out of the plan, there's a really desperate need. I mean, 22% poverty level in Athens, Clarke County and the surrounding areas, when Georgia has a 14%. So there's something major going on here. So, but if you meet those two criteria, you get an appointment, you get to see us. We started out with the very basics: high blood pressure, diabetes, arthritis, some respiratory issues. And as we got more secure in what we were doing, we started taking, at first we couldn't give insulin. Now we can, because we found resources to help us get insulin for our patients and all the other very expensive non-generic medications. We have a person whose only job is to match up the patient with the drug company that makes it and gives it for free. We did $3.8 million in free medications to those specific patients.
Wow.
We're going to have a big surprise coming out at our fundraiser, which is on the 22nd of July. But we are looking at changing our name to become more inclusive, because it's not just a nurse's clinic anymore. We have 2 family practice physicians who come over and spend some time. So patients that we normally might have had to refer out, they can see. We have a nurse practitioner who has her doctorate in counseling, so he can now provide mental health counseling here, which takes some of the stress off of Advantage. We have a dermatology PA who comes over and does derm, which is something we've had a lot of trouble getting. And with homeless clients who live in the woods or under a tree or a bush, they have a lot of dermatology issues.
Sure.
Our latest and greatest is our new vision clinic. The Georgia Charitable Care Association, working with Prevent Blindness Georgia, they send people out, and the wonderful Dr. Nadine Forche comes in also. And we have this sort of maze going through all of our rooms where they stop step by step and they get their eyes dilated or they get whatever checked out. And at the end stage, after she's seen them, and this is critical for people who have diabetes, and so many of our patients had uncontrolled diabetes, then they get to pick out glasses, and the glasses come in 6 to 8 weeks. And I remember when I was in 4th grade and they told me I needed glasses, and I thought they were just crazy, and I was insulted. And then I put them on and suddenly I could read the board.
Yeah.
It's hard to get a job when you can't see what you're doing, when you can't focus, when you can't read.
Yep.
So that's what our clinic does. We treat patients we have a hepatitis C clinic. We have a very busy dental clinic. They see about 30 patients a month. I had a running count on how many teeth we had pulled for a different grant, but it was well over 300 this fiscal year. We work with the students at Athens Tech. They come in on Wednesdays and clean teeth for our patients, which is critical because many of our patients haven't seen a dentist since they were a child and the little buses came to the schools. We have students from university who come and do internships with us. We've apparently become a very in-demand place because they get to do a lot of hands-on and a lot of teaching. We have classes in our front room, waiting room, hallway, whatever. We used to have an exercise class. It's too hot right now, but they practice different types of exercises. We used to call it yoga in the yard because we go downstairs to the yard. We have yoga in the yard. We work with the SNAP educators. They come and they do health cooking classes, and the clients who attend get a gift card and a present, and they get to watch her cooking the food and get to eat the food. We have smoking cessation classes. We have just everything we can because our goal is really harm reduction. We say our goal is to make sure that uninsured patients get the best health care possible at no cost. And that is really harm reduction. I will tell you a quick story. We had a man who came to see us after 3 or 4 years of going back and forth to the emergency room with this really bad pain up here. And they would give him some antibiotics and send him out. And he would take the antibiotics, and 2 or 3 months later, his face would be swollen. So he came to see us. And our dentist did an x-ray and found a piece of tooth that was left behind 4 years earlier, and went in and took it out. His swelling stopped, the infection stopped. He could eat, because with bad teeth, you have such a risk for malnutrition. Oh, it's terrible. Another one was a really nice gentleman who came to see us. We got a phone call from the hospital, and they said, listen, would you mind seeing him? We've seen him like every quarter for the last 3 years, and we just don't think he's compliant with his diabetic protocols. He was living in a tool shed, a gardening shed behind some people's house, and he would do yard work for 3 or 4 houses, and he would make about $15 or $20 a week. And he admitted that most of his meals were from McDonald's or Wendy's because he could get to those. And so I said to my students, now I want you to talk to him and see what he really knows about diabetes. See if he knows how important it is to check his blood sugar and check his feet. So they went in and talked to him, and he looked at him and he explained it. And then he said, I'm not really stupid. I'm just poor. And what he meant was, when he left the hospital with a prescription in hand, he had no way to fill that prescription. So if we can catch people who are just approaching diabetes, or who have sort of controlled blood pressure, and we can get them under control, we can get them healthier. That helps them, it helps their family, it helps their neighborhood, and it helps the community of Athens. So we are here to reduce the harm of not having health care. So we see about 180 people a month. We have about 1,200 on our roster, but for a certain percent of those patients, it's very flexible. If you are homeless, like when we did the homeless count, we knew we weren't really counting them all. So our homeless come in, and sometimes they don't come back. We do the intake for people who are going into drug and alcohol treatment programs. Sometimes, and a lot of times, we discover that because they have been using for so long, it's impacted other parts of their body, and we can take care of them and get them healthier in more ways than one.
Absolutely.
But that's what we do.
You guys do so much. I mean, I know that you could just go on and on and on and share story after story of how the Athens Nurses Clinic positively impacts the folks in this community that you serve. And I think it's just wonderful. And knowing all that you do, I know there are thousands and thousands of uses for the dollars that folks like us and others contribute to the Athens Nurses Clinic. So tell me, how can others support the Athens Nurses Clinic? And I bet one of those ways is by participating in your upcoming fundraiser.
Yes, they can come to the fundraiser. For those who haven't come before, the farmers market gives us fresh tomatoes. This is our 13th year. It's really only our 12th year because we had to cut out 1 year for COVID. But the farmers market farmers give us fresh local tomatoes. An independent bakery in 5 Points gives us baguettes. And somebody usually bakes us a whole bunch of bacon. Okay, it's not the healthiest, but still it's good. And we make fresh tomato sandwiches. We have olive oil or mayonnaise. Someone else bakes cookies, and we do it at Terrapin. So you pay the Terrapin entry fee. And then we have sponsors who are helping us with some of the cost. And then we have donation buckets at the tomato sandwich line. So any of those things are help. And just, it's fun to come because people can, my interns just love it. They love what they're doing. It changes their entire mindset, because most of our interns, college students, have never seen somebody who's really sleeping in a tent by the river homeless. They hear about it, but they've never really seen it. And so they get to talk about what they're doing and the patients they're seeing. And you get to talk to our nurse practitioners and now our new volunteer physicians. And that's one really good way. The other way is we always need donations. Cash is preferred because we still have to pay for the medications and the lab testing and everything else. But paper, regular toilet paper. Some people, we have groups that bring us bags with women's personal health supplies that we can pass out. We're going to use, I asked some of the practitioners, we think we're going to use that $1,000 because we've never had to have patients pay for anything, but the prevent blindness people have to charge for the glasses. And that $1,000 will pay for 30 people to have free glasses.
That's so cool.
One of our gentlemen who came in, they were broken. They were taped in place. They were down on his nose. He had been that way 6 years. And when he got his new glasses, and it was like, wow, I can see.
That
But
is
also, yeah, and it could also go for, we use one specific brand of diabetic blood sugar testing equipment. We do that because when we used to take donations of different kinds, patients would come in and say, I need some more strips, but they didn't know what kind of machine they had. We didn't know what kind of machine. So we give them the machine and the strips and the lancets. So we go through about $400 worth of those a month. Our medication bill, we found another great nonprofit. It's based out of Atlanta, that the way we work is that we see the patients, we write the prescription, we send it to this nonprofit. It's called Good Pills. And in a week, all those patients' medications for up to 90 days are back.
wow.
And our average Good Pill bill is only about $800 a month. So that $1,000 could cover 90 days worth of medications for 175 people.
Wow, that is just incredible. And I love how you guys have, not only are you partnering with, volunteers and professional volunteers and things to provide these services, but you're also thinking outside the box to get the actual products and things and prescriptions and things that your patients need. So I know that with healthcare, there's never enough money to go around. So tell us how someone can donate to the Athens Nurses Clinic.
Well, they can go to our website and there's a big donate here button and they can just hit that and do it through PayPal, or they can send us a check to P.O. Box 1732, Athens, and that's 30603. It's the downtown post office. Or if somebody wants to see what we do, they can come by here Monday, Tuesday, or Wednesday between 8:30 and 3, and we'll take them on a tour of the clinic. We'll show them our operatories, and it's all new dental equipment. We had a matching grant in 2016 when we moved into this building to get all brand new equipment.
Wow.
And if anybody listening is a dentist, we need more dentists. We are backed up to September on our dental list.
Wow. Okay. Well, those are good needs to put out there. So you heard it from Paige. If you'd like to donate, you may navigate to their website. And what's your website, Paige?
www.athensnursesclinic.org.
Fantastic. So head on over to athensnursesclinic.org to learn more about Athens Nurses Clinic, or drop by as Paige just extended the invitation for us all to come, or particularly if you're a dentist, volunteer, but I'm sure anyone can volunteer as well. And yes, volunteers are always in demand. So if you'd like to learn more, head over to the Athens Nurses Clinic website, or you can also visit our website, elevate-wealth.com, and learn more about Athens Nurses Clinic or any of the other organizations that we're supporting in our 40 for 40 initiative. And thank you so much, Paige. Thank you for being with me today. And thank you so much for all that you and the Athens Nurses Clinic do to serve our community.
Well, thank you. And thank the 40 by 40 because we're really grateful.
You're so welcome.